Prioritize DX is a decision-making tool designed to support Ministries of Health, technical experts, and COVID-19 task forces to strategically allocate diagnostic resources. In an ideal world, COVID-19 testing would be widely available. However, the reality in many countries is that testing supplies are limited, implementation is challenging, and a successful testing strategy must be highly strategic and context-specific. While ineffective strategies can lead to wasted resources and continued spread, prioritized testing can lead to millions of dollars better spent and improved health outcomes and epidemic management for our populations. The Prioritized DX tool was developed by the Pandemic Response Initiative, or PRI, a partnership between IDinsight and the Institute of Global Health Sciences at the University of California, San Francisco. As we introduce the Prioritized DX tool and how it works, please keep in mind that our team is also offering free support in using the tool and implementing its recommendations. This tool helps answer questions like: which patients at facilities should be tested? Those with mild or severe symptoms. How should tests be used in areas with just a few confirmed cases? In an outbreak setting, should we prioritize testing recent travelers, health workers, or the elderly? The answer to these questions depend on the context and how each testing use case is weighed within our methodology. Prioritized DX is based on the idea that a high-value COVID test must fulfill three characteristics. First, information from the test must reduce uncertainty about someone's COVID status. For example, in a large outbreak setting, we don't necessarily need a test to tell us that a patient presenting with severe respiratory symptoms likely has COVID. Second, the test result must be linked to action. For instance, if a positive result convinces the patient to isolate, or if a rise in positive cases leads the government to implement strict social distancing measures, then the test is contributing a great deal of value. And third, the use of this test must contribute to epidemic management goals like reducing transmission, understanding disease burden, decreasing morbidity and mortality, and maintaining the healthcare system. Some uses of tests are more clearly linked to these goals than others. Before using the prioritization tool, be sure to review your country's current COVID-19 situation, including testing supplies, isolation and lockdown procedures, and the geographic distribution of current cases. There are 2 steps to using the tool. First, input details about your country, including isolation and test-seeking behavior, test turnaround time, and effectiveness of contact tracing. Second, review the automatically generated context-specific output. The columns are based on transmission level. Large outbreaks are areas with widespread community transmission. Small outbreaks are areas with just a few case clusters. And finally, some areas may have no reported cases. The rows are population groups, including patients at facilities, high-risk groups like frontline healthcare workers and travelers, community surveillance, and contact tracing. Each cell in the matrix indicates a priority level according to the 3 criteria of a high-value test. Dark blue boxes are highest priority for testing, and light blue are the lowest priority. Let's consider an example. Imagine you're a decision maker in a country with limited healthcare resources and capacity. COVID-19 testing has a turnaround time of 6 to 9 days. and many people struggle to isolate because they live in large households and rely on working outside their home for their livelihoods. So far, your country is currently testing symptomatic patients in large cities and people at major transport hubs like border crossings. However, after using prioritized DX, you start to reconsider. In cities with large outbreaks, you can reasonably assume that many symptomatic patients have COVID and provide care, treatment, and isolation guidance without requiring a test. When considering travelers, you realize that when a result takes 6 to 9 days, this information is coming too late to guide decisions. The tool's output suggests 2 additional uses of limited testing resources, particularly in areas that are not current hotspots. First, in areas without current cases, prioritize symptomatic frontline healthcare workers and high-risk people, plus anyone with severe symptoms. These populations will be the best indication that COVID-19 has entered the population. Second, dedicate additional tests to areas with only a few case clusters right now, because there is a better chance of using testing to stop transmission and prevent larger outbreaks. More prioritized and strategic testing will help countries around the world move closer to achieving epidemic control. You can access the latest version of the Prioritized DX tool for free on IDinsight's website. For additional support and guidance in using the tool and implementing these recommendations, please get in touch at diagnostics@idinsight.org.